Now we've covered what sciatica is, how it presents, and what not to do. Now we can start to talk about some foundational exercises that you can do at home to start reducing symptoms and moving better. As always, I'm a licensed physical therapist, and these exercises are based both on evidence and years of clinical experience. Before starting, consult your healthcare provider if you have any medical concerns. No exercise should push your pain past a 3 out of 10 or make your symptoms worse. If anything is unclear, reference your universal guide to safe exercise. If a movement aggravates your symptoms, pause it and come back to it later. Each exercise in this series should be done twice daily until your symptoms start to ease or is tolerated. You can repeat the exercises in the morning and again in the evening, or you can use them as you feel symptoms. These exercises are designed to be the medicine for your condition. I also want to state that I don't like putting timelines on these levels in this course. There is no hard deadline. Everyone's body heals and responds at a different pace, especially with nerve-related conditions like sciatica. Some people progress faster, while others may need extra time at a level before moving on. That's completely normal. The goal isn't to hit a specific week. Instead, focus on listening to your body, noticing how your symptoms respond, and progressing safely. Let's get started. So we talked about a lot so far. Let's get into the exercises. So our first exercise is going to be what's called the sciatic nerve glide. We talked a lot about how nerves don't like to be stretched, but they love to be what's called flossed or glided. So to do that, I'm going to instruct the patient here to go ahead and bend her knee up so her hip comes to about 90 degrees here. She's going to grab underneath her knee. She's going to straighten her knee and her foot comes back forth and her knee is going to bend back down. This is 1 repetition. You're shooting for about 20 repetitions. I have patients here all the time though that can only get to 5 or 10 reps if their nerve is very sensitive, and that's okay. You do what you can at home. You're going to repeat this 2 times a day until symptoms start to subside. Our next level 1 exercise here is going to be what's called a pelvic tilt. This is going to start to engage some of our deeper core muscles to help stabilize our spine and reduce the symptoms of sciatica. So I'm going to cue the patient here. I'm going to put my hand underneath her low back. I'm going to say, go ahead and smush my hand here. So she's flattening her low back into my hand. The big key here is no holding your breath. She's going to hold 1, 2, 3, 4, 5, and then relax. I'm going to take my hand out and then instruct her, go ahead and just flatten your low back to the table, just like I did. 1, 2, 3, 4, 5, and repeat. If you hold your breath, you don't actually strengthen the muscles of your core. So it's very important to just breathe naturally and then push and hold. You're going to repeat this 20 times, 2 times a day. So the next level 1 exercise is going to be what I like to call controlled movement. For this one, you're going to have to do a little bit of self-homework. At home, what I want you to do is stand up. I want you to try and touch your toes as best that you can. Come on back up. I want you to cross your arms, and then you're going to extend back. Usually for patients with active sciatica, one of those is going to feel better than the other one. If going down hurts, but going back feels good, the exercise that I want you to do is you're going to come on your stomach, and you're going to do what we call a prone press up. So you're going to be on your stomach, and you're just going to kind of push up, extending those elbows. Nice and slow and controlled. Each one is 1. You're going to shoot for 20 repetitions. Oops. Now, if you're the opposite and going down feels really good, but going back hurts, what you're going to do is set up a chair here. You're going to sit here, and you're going to do what we call a table slide. You're going to grab the towel, and you're just going to kind of work forward. Back, work forward, back. You're going to shoot for 20 reps. The goal here is you're moving into the direction that feels good. You're not moving into the direction that hurts. Whichever way feels good for you, I want you to do 20 repetitions 2 times daily. So these next 2 exercises here are just going to be a progression of what you just learned. You just learned how to pelvic tilt. Now we're just going to make it a little bit more dynamic. So the first exercise here, I'm going to have the patient go ahead and pelvic tilt. and she's going to do a little march up to waist height and back down, and then alternate. Each side is 1. You're shooting for about 20 repetitions. The 2 keys here are no holding your breath and to maintain the pelvic tilt while you march. It's totally okay to break up the repetitions and take breaks during the 20 reps. The next exercise here, she's going to bring her feet together. She's going to pelvic tilt just like she's been doing. She's going to let one knee drop out to the side and back up, and then alternate. Each side is 1. You're shooting for about 20 repetitions here again. The key again is no holding your breath and maintaining the pelvic tilt throughout the exercise. If you need to take breaks, you go ahead and take breaks to get to 20 reps.